Here's the bad news. This is a very, very, very difficult fungus to get rid of long term. Today we're going to dive into a topic that affects millions, yes, millions, toenail fungus. Now, I'm here to clear the air and reveal some surprising myths behind this stubborn condition. But before we jump in, make sure you subscribe if you're watching on YouTube or follow if you're listening to the podcast. Okay, let's get started. How about myth number one? Myth number one, it's not the same as athlete's foot. Wrong. Actually, it's exactly the same as athlete's foot. It's exactly the same as crotch rot. And this is caused by the same fungus. That's the first thing I want you to understand. Just like athlete's foot, toenail fungus is ubiquitous, and it's generally not a cause for concern. It develops first on your feet, and it can cause, as anyone knows, itching, burning, stinging, redness, and you don't have to be an athlete to get athlete's foot. Myth number two. Fungus loves sugar. Now, many people believe that toenail fungus or athlete's foot fungus feeds off of sugar, and they do whatever they can to avoid sugar to try and get rid of it. Wrong. It turns out that this fungus is not after the sugar in your skin or your toenail. It's actually after keratin, which is a protein found in hair, nails, and skin, not sugar. And avoiding all the sugar in the world is not going to change whether or not you're going to get toenail fungus or whether you're going to get rid of it. Now, that's kind of like myth number three. Fungus on the feet is caused by a gut problem. Now, some people think that if you have fungus on your feet or your nails, it must be caused by a growth of fungus on the inside of you. Now, I'm the first to say that all disease begins in the gut. But this is simply not the case for athlete's foot or toenail fungus. It really, unfortunately, has nothing to do with your gut. And it's not a direct sign of an imbalanced gut or any other issue in your gut. However, there is some evidence that people who develop fungal infections in their feet or nails may have an immune system that is not good at recognizing fungal elements as mischievous. And there's a lot more research going into this. So it's not an overgrowth of candida in your gut. It's not an overgrowth of mold in your gut. It's not black mold growing in your shower. This is a fungus that's ubiquitous that's growing on your feet. Myth number four, you're at higher risk if you've had your spleen removed. Now, there's a bit of truth to this, but not what you think. We know that people who've had a splenectomy for various reasons, most of the time from blunt trauma from an auto accident or a fall, and I've taken out some spleens in my career. We know that people who lack a spleen are more susceptible to bacterial infections. And let's be clear, a fungus is not a bacteria. They're totally unrelated. So the proviso is that if you've had your spleen removed, you are more at risk from bacterial infections, such as, for instance, pneumococcal pneumonia. And that's why in people who we've removed their spleen, we use pneumococcal vaccines, among other things, for these people because they're at increased risk. Myth number five, treatments like Vick's VapoRub or brushing your toes with baking soda will do the trick. Wrong. I've seen these treatments online, and let me be the first to tell you, they're not going to work. And if they have any effect, the effect is short-lived. Here's the bad news. This is a very, very, very difficult fungus to get rid of long term. In fact, athlete's foot in general is very resistant to treatment, even the prescriptions given by a doctor. Now, I want to talk about these antifungal prescriptions for a moment. Yes, they will kill off the fungus in your nail if you take them long enough. But that treatment often is a year or more. And here's the bad news. I personally have done 2 liver transplants in patients who were taking these oral antifungal medicines, and you might be one of the unlucky ones where this medication literally kills your liver. And there's a black box warning on these things, and I've seen it in several patients in my own practice now who unwittingly were put on these oral antifungal medications for their toenail fungus, and within a month, I immediately saw their liver enzymes going up, indicating that their liver was already being damaged. So please, please, please do not be talked into an oral antifungal medication. Now, there are a lot of topical treatments as well. There are a number of effective antifungal athlete foot treatments. Each one works a little bit differently. And interestingly enough, each individual seems to have 1 or 2 of these compounds that are more effective than a different compound. So it's kind of a trial and error to see which one works. But remember, just because it works topically on your athlete's foot doesn't mean it's going to work deep inside your nail bed. These infections actually start deep inside the nail bed, and that's where the problem lies. These topical treatments just can't get there. Finally, a few years ago, laser therapy for toenail fungus was a big deal. And yes, laser therapy will destroy toenail fungus. But sadly, I've seen so many of my patients, as the new nail grows out, the fungal infection comes back. So, yes, the lasers will work, but more than likely, that infection will come back because it is so deep in the nail bed. Okay, so what can you do? First of all, don't panic. There's absolutely nothing wrong with you. This is everywhere. You wouldn't believe how common it is in people I see every day. It was almost always in every one of my patients who I did heart surgery on. So it's everywhere. We just don't talk about it very much. Just remember, it is highly contagious. So you have to take caution when you're at the gym, doing yoga. Be careful about being barefoot on shared yoga mats, and taking a shower at the gym, and using equipment barefoot. Also remember that these funguses thrive in warm, moist locations. So it sounds obvious, but the more you can keep your feet dry and clean, the better off you are long term. Finally, if these things really bother you, just remember that the topical treatments for athlete's foot will be effective for you, but don't hold out hope that they're really going to have much effect, if any, on your actual toenail fungus. Thanks so much for watching this episode, but don't go anywhere. I think you're going to love this next one. The liver is far more important as a detoxification center than you think.